that people understand what we're seeing in Explant. So 29% of the time we find this bacterial contamination. And so I'm going to take it a step further so everybody understands how this works now. I used to hypothesize that because you had a contaminant of bacterial biofilm, that you would have immune system stimulation or activation that could give you symptoms. Well, we now know that's the case. So your immune system does get activated because the bacterial contamination interacts with a fatty acid in the breast tissue called oleic acid. That oleic acid will oxidize. Everybody probably who listens to your program of mine understands that oxidative stress or oxidation is not what we want. We want less of that because that builds up in our system and that's harder for our bodies to clear depending on how we detoxify things. And so it creates something called oxylipin 10-ho. And that oxylipin leads to more symptoms that are associated with breast implant illness, like fatigue, like anxiety, like muscle and joint pains. So those are all things that I used to just hypothesize were happening, but now they've been shown that that's truly the case in patients with large amount of symptoms of breast implant illness. It was published this past year, and the scientist is Dr. Mithun Sina. I've had him on my show and interviewed him. He's done just amazing work in this field.
Dr. Rob Whitfield, welcome to Passion, Love, Pursuit podcast. This is a long-awaited conversation to have with you. As I mentioned kind of offline, I was not at first really thrilled to have the conversation, and I'm just going to be really transparent in saying that because I myself, this topic is obviously based around breast implants and breast implant illness. I have breast implants, and when I first started hearing about the BII, I dug really deep into it because I'm all about optimizing my health. And so it caused me a little anxiety. It caused me this fear of, oh my gosh, do I have BII? And now what? And so I kind of went down the rabbit hole and, it highlighted something that I'm like, okay, maybe this is something that I need to address and maybe not now, but later at least. And so I was a little fearful to have the conversation because I didn't want that anxiety to come back in, but I've released that and I'm excited to now have the conversation because I think the more information you know, the better you're equipped to address your health in the best way possible. So anyways, welcome to the show.
Thank you so much for having me. I mean, nobody really wants to talk about what I got to talk about. So
I know, but we're going to go deep in the trenches because as I said, I think that, the more information, at least we can make the best informed decision that's best for our health and also those around us, because how much our health affects us, it affects others around us and how we show up. So first question, you're known as, of course, the breast implant illness expert and also renowned as the best doctor in America as well. So I would love to know what became apparent to you that breast implant illness was a thing and how that informed your expertise today?
Yeah, for everybody listening, my background's in oncology. So I know there's a lot of terms used about, holistic and natural and things in the just the community at large in wellness. And I used to do reconstruction basically with your own tissue for breast and head and neck and other, cancers. So my background's all in oncology. And in 2016, I had a breast cancer patient come to me who wanted to go flat. And I recently did a segment for a documentary about going flat. And so they wanted to remove their reconstruction. And so I had done that in my career several times to accommodate patients who no longer wanted to have the reconstruction, or maybe there was some other issue with it. So I took care of her. And for everybody listening, I try to take all of the materials out. So your scar tissue and the capsular material together, think of it like an undisturbed Easter egg is the way I try to, convey what I'm trying to do. And so you can do that. It's easier or harder depending on the thickness of your scar tissue around it. Did that for her. We sent everything off to pathology. Pathology looks for any kind of recurrent cancers or new cancers for that matter. And there are breast implant associated cancers. We've heard there's a lymphoma, there's a squamous cell carcinoma that are associated with breast implants. So you always send that material off to make sure nobody has recurrent breast cancer, Nobody has one of these implant-associated cancers. And then I also sent everything off to make sure there was no infection. And at a week, when we got all the results back, she had no recurrent cancer, which was obviously the most important thing, but she had an E. coli infection. And when we went back and looked through all of the data, and we were just double checking to make sure we didn't miss anything somehow, there wasn't anything that we missed. She had an occult or a hidden breast implant infection. And, I get asked all the time, well, how did that happen? So for everybody listening, whether it's a hip, knee, breast, dental, neurologic, spinal, or any kind of implant, when it's placed, there are processes and systems in the operating rooms to avoid contamination of an implant. So it's very rare that one would get contaminated on placement, for everybody listening. This is more in my mind. Over time, we get exposed to different things. And I'm sure on your show, as well as my show, we talk about the different exposures we can get through the environment and through products we use. But in this specific instance, we're talking about how someone, say, gets a cut on their skin and it gets inflamed or infected, and that bacteria from the cut enters our bloodstream. And because it's an implant, whether it's hip, knee, breast, dental, like I said, it can become attached to the implant because the implant's not your tissue. It doesn't have a blood supply. So why does that matter? Well, your body can't clear that. So in our immune system, we have a series of cells called natural killer cells, and they help surveil our system and protect us. It's like our own, cells trying to look out for us for cancer and infection and all these things, viruses. But this can't be eradicated. And some of these communities of bacteria produce a biofilm. The biofilm makes it even more complicated for your immune system to get rid of it. Things like staph epidermidis, everybody's heard of staph infection. So staph epidermidis is commonly found in our skin, and another bacteria called Cutibacterium acnes, which is also found in our skin, especially on our face. Acne, Cutibacterium acnes is part of that. Chest, shoulders, neck. Those two types of bacteria readily produce biofilm. And we recently published a paper that shows Cutibacterium acnes and then staph in our series are relatively the two most common things we find on those specimens when we take them out and send them off for testing. We use PCR testing. So we published that to establish a rate so that people understand what we're seeing in explants. So 29% of the time we find this bacterial contamination. And so I'm going to take it a step further so everybody understands how this works now. I used to hypothesize that because you had a contaminant of bacterial biofilm, that you would have immune system stimulation or activation that could give you symptoms. Well, we now know that's the case. So your immune system does get activated because the bacterial contamination interacts with a fatty acid in the breast tissue called oleic acid. That oleic acid will oxidize. Everybody probably who listens to your program and mine understands that oxidative stress or oxidation is not what we want. We want less of that because that builds up in our system, and that's harder for our bodies to clear depending on how we detoxify things. And so it creates something called oxylipin 10-HO. And that oxylipin leads to more symptoms that are associated with breast implant illness, like fatigue, like anxiety, like muscle and joint pains. So those are all things that I used to just hypothesize were happening, but now they've been shown that that's truly the case in patients with large amount of symptoms of breast implant illness. It was published this past year, and the scientist is Dr. Mithun Sina. I've had him on my show and interviewed him. He's done just amazing work in this field.
Oh gosh. Okay, there's so much information. So you're saying that so to my understanding, the biofilm that is then created in the capsule, am I correct?
Scar tissue, your scar tissue, yes, the capsule.
So how is that, if it's not developed through inserting it, how is it created after it's implanted? What Like what would
Yeah,
if
so
you could,
bacteria gets in our bloodstream. And
and
so
so that could be through a cut, you're saying, or
yeah, could be a cut. You could have got a urinary tract infection, an upper
mm,
respiratory tract infection. You could have a GI tract infection. There's a host of ways that we're constantly getting exposed to bacteria, but the teeth cleaning. Every
right?
time you go get your teeth cleaned, you get exposed to bacteria. So when I was in training, all of the cardiac patients who were getting, say a heart surgery, a heart valve, a prosthetic insertion, so a foreign body insertion, you had to look in their mouth to make sure they didn't have a cavity.
Hmm.
And if they did, you would cancel them because you obviously don't want somebody's heart valve to get infected.
Wow.
And
Okay.
so in the, times, I joke, I'm older now, I'm 55. So I trained at a time where there are lots of things happening in terms of surgery and prosthetics. And they went from mechanical heart valves to pig heart valves. So if you had a mechanical heart valve, you could listen to their chest and hear it ping. So if you gave that person any kind of treatment that stirred up bacteria, maybe they got a colonoscopy and a biopsy, maybe they got their teeth cleaned. If you did that and didn't protect them with a prophylactic antibiotic, you would increase the chance that they would get bacteria in their bloodstream, and that would attach to their heart valve and give them what's called endocarditis. None of this is rocket science. This has gone on
Right.
forever. It's not a new thing. So everybody who's got a prosthetic, should have been counseled about, hey, when you have these potential exposures, this would be, an outcome that could happen. I mean, any implant could get infected. If we're sitting here talking like that's not a possibility, then, we're not really informing everybody properly, because of course it can get infected. I
Yeah.
think the problem with breast implant illness is because nobody shows up to my office with a big red swollen breast. If that was the case, everybody would be like, oh, it's an infection. But just like the example I used in 2016, that patient had an infection, but there were no external signs and symptoms of an infection. She didn't have a fever. She didn't have a blood cell count that was abnormal. Her white blood cells were normal. Her SED rate was normal. Her physical examination, her skin was normal. She didn't. There wasn't anything to tell you that she had an infection.
Yeah.
I found that forensically after the fact by removal.
Okay, so we'll go deep into this. So how we discover and what's the things to look out, the red flags and all these things. But first I want to mention, because, when did I get my breast implants? I'm trying to remember. I think it was 2005. I'm not sure. But anyways, at this time for so long, I mean, breast implants have been input for years and years. And so women, of course, just assume it's been done for so many years that's safe, and they don't really question otherwise because heck, it's been done for a long time. Only till now, or maybe a few years prior to this conversation, did we actually have more knowledge about it, that actually putting in this foreign object into your body, that there could be, your body could either reject it, or things, as you're talking about, could happen. And so I know for women listening, like, we're disappointed, we're upset that like we didn't know all this now, but I know there's so much more in health that is being discovered today. So thankfully, thank God for that, right? But I know in 2019, I came upon breast implant illness. This is really when it started to be surfacing and people started to talk about it. And I remember joining this group it was on Facebook, called, I think it was Breast Implant Illness by Nicole.
Mm-hmm.
And it was a huge group. And I looked recently, yesterday, just preparing for this interview, there's just about 200,000 members of that. And I remember at the time, 2019, everybody was sharing their stories, and they felt finally heard, because, you go to a
Right.
doctor, you mention all these symptoms, and then they're like, oh, you're fine. Or, whatever they send you off with, whatever prescription to deal with your symptoms. So would you say today, especially as we're talking about this now, that is finally changing, that actually doctors are acknowledging it? Or what do you think is like the landscape today?
I testified at the FDA hearings in 2019 about breast
Hmm.
implant illness. So I would say from that standpoint, you would have to be living under an effing rock not to know better at this point. but I
Yeah.
still get patients telling me that they've seen a doctor. I'm not going to specify what type of doctor, who still say that that's, this is not a true problem. So that still exists. I would like to believe that that's less common, but I still get that because I
Yeah.
see people from all over the world. I don't just see people, in Austin, Texas, where I am. I have somebody in town from London right now. So the issue is still one of education and or access, however we want to interchange those two. So the patients still need to educate themselves. So, I've done 100 different episodes of my show, and I've been on a bunch of shows, just like I'm appearing to discuss it now. It's a implant. It should be understood that all implants can get, we're discussing biofilm or low-grade infections, and they can become infected. That's part of explaining placement of an implant. Doesn't matter if it's for cosmetic or reconstructive purposes. So that's, first and foremost. And I get asked a lot, like, in my career, did I put a lot of implants in? And because I did a lot of oncology, the short answer is no. And, I find it difficult in conversations, and just to be perfectly clear, when you're younger, just taking into consideration what I had discussed in relationship to cancer reconstruction, the ramifications and long-term consequences of that, it's always very, very hard to have those discussions with people when they're younger.
Oh, I know.
So
Right.
that's first and foremost. Like, I get patients come in all the time and tell me they didn't know all the long-term ramifications of having a breast implant. And I totally, I get that. I have a daughter who's, 16, going to be 17. I get asked would I let her have implants. Well, first of all, my daughter's a Leo like me, so I'm not going to
Oh,
be able
I'm
to
a Leo
explain.
too. There you go.
You're not going to tell a Leo what they can and cannot do.
True.
That's just not practical. So what I can do is just simply educate patients so they can make informed decisions. So you have to make a decision, one way or the other, what you're going to do. And it's a complicated one when you're talking about a medical device, whether it's a knee, hip, breast, dental, neurologic. There's a risk benefit to all those things. So that's not going to change. Would I like to have, patients have the most complete explanations, based on the current evidence? Well, of course. That's what people are still going to make the same. It's their choice. It's not your choice or my choice. They're still going to make their choices. That's more of what I would like. Like, yes, these are devices and they can have problems. That's what you need to understand.
Absolutely. So would you say timing of implant that you've had it in your body, the more chance, like, would you say that the longer you have it, that's when symptoms start to show up? Or I know a friend that actually had it within the first year. She had severe UTIs and she got it explanted, I think a year and a half after getting it. And then I had friends that were at the 10-year mark and over get them removed. So would you say it matters, the timing, or just really you could start to see symptoms at any time?
Yeah, just like you're highlighting. It can be at any time, of course. If you just look at a spectrum of people, you would see more of a bell-shaped curve. So you would have some people at either end of the spectrum, like you're describing. Probably very few in the beginning and very few at 30 years out. The majority of them would be in the 10 to 15, 20-year type range. But that's, there's a lot of factors at play in that.
Yeah, of course.
So,
I was just wondering more like the common, so that answered my question. And then I know a lot of people ask this. I kind of already know the answer, but I'm going to ask for the other people listening. Saline versus silicone, does it matter?
no, doesn't matter.
Okay.
Yeah, we published a paper that shows that the filler is not the issue. And just so everybody hears this again, I get tired of little trolls on the internet and the mold. So I published a paper to dispel the myth that mold is the biggest problem with implants. So let's just understand that it's bacterial contamination, not fungus, which is mold.
So good to clear that up, because I know we see all these things on Instagram and then like that's highlighted.
Oh, yes. Love them. Hey, for anybody listening who wants to discuss mold and implants, you can, submit your request to my show, but please don't post stupid stuff because I will come and comment on it.
Love it. Okay. Yeah. So, okay. The other question I have is, do our genetics play a role in any of this? The more chance of getting BII symptoms or rejecting an implant, whatever it may be?
Yeah, this is the thing that we want to submit a paper about as soon as we get all the, data analyzed. We've been looking at genetics, and there are pretty distinct patterns. And just for lack of a better explanation until we publish a paper about it, if you don't detoxify things well, of course, you're going to have a more difficult time if you have an implant in place. So, or if you show up with an autoimmune problem. I mean, come on, let's just think and use our common sense. Like if you already struggle with, fighting off the common cold, or you already have problems with Hashimoto's or MS or something, Sjogren's syndrome, well, that's not going to get better if you have an implant placed. And it doesn't matter what type of implant gets placed. None of that is going to be in your favor. So just let's use common sense.
Yeah. Actually, I'll just share my own personal story about this. So I discovered, I think like 15 years ago, I had scalp psoriasis. So I had an autoimmune disease. And then I got implants, and it's come up here and there, but there's been times where it's flared up really bad. And one of those incidents was actually the end of last year. And I directly went to gut testing because I know a lot of psoriasis stems in the gut. And I found out that I had leaky gut, I had high histamines, I had all these things to address. And then finally I went on a protocol and did significantly see a difference, and like wildly different. I still have the scalp psoriasis. It's just not even close as bad. But that was one thing that I was, as I'm listening to your content and these interviews, is that, even though you had it before, that doesn't mean, because I was curious if like, okay, of course the question came in my head, like, did me getting breast implants cause this problem? But I'm like, no, I had the problem beforehand. But you're explaining that it could make it worse.
Yeah, I don't, first of all, the first breast implant was placed in 1962 in Houston. So if you just use, the Google machine or ChatGPT, however you're acquiring information these days, you're going to find out that autoimmune disorders predate implants. So that's all you need to know.
Right.
That's just full stop. Like autoimmune disorders predate implants. So when you add an implant, are you making that worse? Well, anything that affects your immune system, the things that, we'll just be very clear. I prioritize sleep over everything else. And then it begins with the quality of, the underappreciated things in life, the air you breathe.
Right.
So everybody's, where do you live?
I'm outside Los Angeles.
Okay. So all you folks who go to Erewhon and buy your damn bottled water from Erewhon probably don't care about the quality of the air in your home versus the filtration of the water you're putting in your system every day, right? So if you think of it like this, you can survive 4 minutes without air. So you better think of it that way, like improve the quality of air. And so what does that do for you? So most of the problems that stem from, oxygenation to the brain happen because of the quality of air and problems with, we'll just say, sleep apnea. So I have sleep apnea. I'm not overweight. I don't have, physical characteristics that would, scream to you, I have sleep apnea, but I have bad sleep apnea. So I have to wear, a CPAP device every night because, my son is 20, my daughter's 16. If they go on to have families and children, I want to be around for, them personally and for, my grandchildren. So I prioritize my sleep, but I prioritize getting oxygen to my brain when I sleep. And the quality of the oxygen is very important. So I have freestanding HEPA filters at every level of our home, and in my office to my right, I have one. So first and foremost, air, and then obviously everybody's more aware of fluids. So you put in, filtered water into the system, and then food, right? So what you're talking about, which is probably really underappreciated, is lowering histamine in your diet, lowering oxalates in your diet. There are lots of things that contribute to immunity issues that just come from your diet. That's why people have so much, they get triggered when you talk about certain types of diets.
Right.
And I'm not here for triggering people on their diet. So I just want people to eat more protein in their diet. It's harder to get more plant-based protein than it is to get animal-based protein. So, however you line up on that argument, it affects how you feel and it affects your immune system. So I get DMs all the time from patients with problems. Should I be doing this? And should I be following that diet? And so what you want to do is help yourself. You already mentioned leaky gut. Leaky gut happens for a variety of reasons.
Right.
But if you have that problem, obviously you have to work to heal that problem. Because if your gut doesn't work, nothing's really going to work.
Yeah.
So those are, we have core things that we foundationally work on in our program SHARP. And one of them is testing for the problems you're describing. So we look at genetics. We look at your personal toxicity burden. So everybody's going to have a different toxicity burden. And so I had a lot of arsenic in my system because I grew up in a place that had bad groundwater. That's a common problem. People think it's, like in Flint, Michigan, it's the lead in the water. It's famous for the water problem. But in general, the most common contaminant in groundwater is arsenic.
Wow.
So that's, you wouldn't know that unless you looked for that. You miss 100% of the things you don't look for. So we look for all those things. And you look at heavy metals. Tin is a really, a difficult problem. And that comes from breakdown both of the shell of an implant, and then there are other ways to get tin. Tins affects your cognitive ability quite a bit. We see a lot of problems with mold. So, if you see mold growing, that's a little late in the game if that's in your home. So the spore content or the mycotoxins from the black mold, if you want to, the ochratoxin comes from black mold. So there's a host of things that can cause problems. And so when we're working with clients from all over the world, our goal is to make sure that we identify as many of those problems as possible, because you got to make a series of big problems into a smaller list of workable problems, and then you can make, headway. If you're talking about gut problems, those things they're not weeks or months.
It took me like 4 months.
Yeah. I mean, unfortunately, our world is all about the quick fix, and there's really no quick fix when you're talking about that problem.
Absolutely. So I want to go a little deeper into people understanding breast implant illness. Of course, I want people to know the common symptoms, and then also how to distinguish if your symptoms are from the implants or something else. Like, for example, how I was mentioning, I went to go to functional testing for my gut to address that specific issue. So what are the core symptoms we should look for? And then how do we distinguish to rule out that it's not from potentially BII?
Yeah, so BII is just chronic inflammation of which a breast implant's involved. So you can have the exact same symptoms and just have a chronic inflammatory process. So just like many patients have leaky gut because they took antibiotics as a kid or Accutane as a kid or whatever, you can have the same exact problem. So our program is set up to help mitigate and treat and help all of those issues. And then, just like I tell everybody, nobody wants to come see me and have an explant. So the program is set up to help the most people to reduce inflammation. And then you see where you stand. If you've decided that you want to have an explant procedure and you want me to do it, then, we'll help facilitate that. If you're in your, community, whether it's in the US or Europe or Asia, you can run our program to the best of our ability. We'll help you do that. Some people are never going to get there, and that's fine. That's a difficult, as you can elaborate on how difficult that decision would be, to come to. And I understand that. So nobody wants to come see me in Austin, Texas, whether it's in person or online. That's just
unless they're so desperate. They're like, get these things out of me. I know this is the cause. Then they're so excited to see you for that reason. But I think it's a hard, and we'll talk about this because I think it's an important thing to address, is the mental aspect around it, because generally people get implants for a reason. I know personally mine was for proportion, because I've done fit modeling for the last 20 years, which is basically a live mannequin for clothing manufacturers. So my proportions are actually the thing that gets me the job. So I've done it for so long, but usually it was my bottom half. And I'm like, okay, I just want to be more proportionate on top. And so I got it for that reason. I wanted small implants. Of course, they insist to go bigger. I'm like, no, trust me. I know I like it small. But, it's like everybody has their reasoning. A lot of self-image things or proportion. And so we'll go into that aspect, but just going back to the symptoms, are there common symptoms that really group together when somebody is actually having BII, like the common, I know brain fog's a common, fatigue, but are there like other ones that you could be like, oh, I have all these?
From a system standpoint, the most common neurologic symptoms we get are brain fog, which for everybody listening is just short-term memory loss. You can't remember where you put your keys. Maybe you have difficulty remembering your kids' names, tasks you have to do. You can have headache, worsening problems with, migraines, neck pain, back pain, shortness of breath, chest pain, chest pressure, gut problems, all sorts of extremity symptoms. It can get a little overwhelming. And that's why when you go to the doctor, the doctor doesn't know what you're talking about. It doesn't make any sense. If you just listen to all those symptoms and rattle them off, do you really expect your GP to understand what you're talking about?
Right. And also,
they're not going to really connect the dots.
Yeah. And of course, the way typical healthcare, they address everything separately, not interconnected. So that's another thing, is the fact that it is all connected. And so we just have to kind of dig deeper into all the things. Is there, because you were talking about chronic inflammation, is there a way to test if you have chronic inflammation around the breast?
Yeah. So that paper I discussed. Scientifically, they looked at that molecule, oxylipidem. I introduced that scientist to a company to help establish some kind of laboratory standard, because everybody wants me to say, all right, what's the test that will tell us if we have this problem? So if they can produce that test, that will help in that patient population who has that specific elevated marker. But there's never, that's not going to suffice, in every single person. So it shouldn't be thought of as oh, that's the test. If I just get that test, then I'm going to know. No, that'll help that segment who has that specific, issue. If it's not that particular bacteria, then that marker is not going to be elevated. It's not universal across everyone. So I don't want everybody to run out and ask their GP what oxylipidem test they can get done really quickly, because it doesn't exist. So that was just found in research this past year and published. It was found and then published this past year in research. So I'm super optimistic as we move forward. More of these things will be identified, and that will further, clarify for patients that there's an actual issue. And I'm under no false impression that that's rapidly going to move through the medical community, and we're magically going to have this epiphany and everything's going to be rainbows and unicorns. I'm a little too old for.
You're not that old. I know you're saying, but you've just been around and you learned a lot. You have a lot of wisdom behind you, for sure.
I know things don't move as quick. So, I just, I feel good that I always say if you're making progress, no matter how slow the progress, that's
Good news.
progress.
Yes. Yeah.
So,
Question, because you brought this up earlier, and maybe this is a personal question on my end, but you brought up your blood count.
mhm.
So if your white blood count is low or high, would if you had BII, which is the bacteria on the film, on the biofilm, would it be elevated or lower?
It may be either or neither.
Okay.
So, people who get ill, so I'm going to say it this way. So, if you're critically ill and you're in the hospital for an infection, you can have a really, really high white blood cell count, or elevated is what they
Mhm.
would say, or super low.
Oh, interesting.
So it's called leukocytosis, that means it's high, or
Right.
leukopenia, that means it's low. And either of those instances, you could have an infection, that's a
Mm.
problem. And you could have a high temperature or a low temperature. Those
So
are both problems. And so it really depends on the person and how they're responding to it. So, once again, that's everybody's going to be different. And if you're otherwise a healthy person, but you don't feel good, why don't you feel good?
always should be the question is why, right? There's always, yeah. Like I was addressing some things that came up on my blood work, blah, blah, blah. Go to the doctor. And of course, I'm asking, but why? And of
Right.
course, they don't give you, it's wild. I won't even go, that's a whole nother topic, but it's wild what they say. And then my question is always, but why is this happening? Why is this off? Like, I'm so healthy. Like, it doesn't make sense. It's not adding up. But that's, I think, what a
So
lot of
that's the
people come to
problem.
you. Yeah.
So that's the problem, right? So
Yeah.
now, rather than you be told that and you be satisfied with that, the question is still in your mind as what you feel as an otherwise healthy person. Why do you feel more fatigue, or why do you feel lack of energy, or you know just as a person functioning at a certain level, you want to know, like, well, amongst my peers, why do I not feel like you know I can do more, or we'll just say I can go to the gym and have more stamina, or I um, in from an energy standpoint, I don't feel like I have enough energy, or from a libido standpoint, as a young person, why don't I have a better libido? Why don't I even have one? I mean, I have people come in their 30s and they have zero libido. Like,
Mm-hmm.
I'm like, okay, so why, that's not normal. And
Right.
I have women all the time come in and it's like, oh, I just thought I was going through, perimenopause. I'm like, you're in your early 30s. That's not perimenopause at all. That's ridiculous. Like, your hair's falling out, you have no energy, no sex drive, your gut's a mess. Like, no, that's not right. That's not how that works. So
Right.
when you have those things early on, and like I said, I'm 55. When I hear somebody who in their early 30s says, I just thought I was getting old, that's laughable.
Right. But there's so many things being put out there on social and all the things and all these narratives. And there's a lot of things and layers going on. But regardless, I think, as we stated, you should be asking why
Yeah. I
instead
mean,
of
that's
like
just,
questioning it. Like, that's not normal, or putting a story behind it. Like, I think you should still question
no.
if you want
In your
optimal health.
early 30s,
Yeah,
if you think you're getting old,
that's
you
a
need to
problem.
go find someone else to help you with whatever it is that you're experiencing, because
Mm.
that is not getting old. For all your listeners, your early 30s is not old.
Yeah. I would love to, and we're going to get into solutions soon, because I'm trying to lay the land of how does somebody, or what to look for when there could be possible BII to address. But I want to get a bunch in. So, kind of last question regards to that is common deficiencies that will happen at the result of having BII. Like, would you say they would have low D? Would they have, you know, I know you mentioned detoxing not well, and there's probably a lot of factors, but
Yeah, so there is a particular kind of profile we'll see, and you mentioned vitamin D, so we'll talk about that. So a lot of folks just genetically have problems with vitamin D, and we'll just leave it at that. So the way to supplement is using D3K2, and then it really revolves around how you absorb things. So going back to your gut, discussion. So if you don't absorb things well, it doesn't really matter how many supplements you take. If you're not absorbing, meaning you're not getting the nutrient value from the supplement, then obviously that's not going to help you as much as it could. So we converted the majority of my line to just liquid or liposomal based supplements so that to the best of our ability, we know you're getting that nutrient because it's being absorbed, not so much in the GI tract, but in the oral cavity, and increasing bioavailability of a substance that you're trying to get into someone's system so that you can help affect change in their overall health. That's how we're thinking about improving and reducing what you're describing, which is a nutrient deficiency problem. So whether it's D3K2 or methylated B or vitamin C or glutathione, we try to get all those things in through a another transport mechanism of this being liposomal. Gotcha. And then, as you mentioned, gut healing is not a 2 or 3 day. It could be several weeks, could be several months phenomenon. And how you approach your diet, it's a
dance, right?
So if you're, I just had a patient, recently. I got a plane last night, and they're messaging us, and they're having lots of joint pain. And so, if you're experiencing a lot of immune issues, you really got to key in on the things in your diet. So cutting out anything processed, that's first and foremost. If you get triggered easily through histamine, you got to cut things out that have histamine. You can further look at things with oxalates in them because you can only handle so much oxalate load. So there are a lot of things from a dietary standpoint you just have to be careful about in your diet. And once again, I'm not here to criticize a particular type of diet. I'm just trying to point out things that
the obvious, right? The truth
in your diet and their triggers, you have to work to control the triggers. This is all within your purview to control, and behavior modification, better sleep, better food quality, fluid quality, air quality are all under our control. And those are the hardest things to change. Like, it's easy to take something, just put it in your routine, but these habits of sleep and the quality of the food and the quality of the fluid and what we're drinking out of, not drinking out of plastic, being more and more mindful. Women put a bunch of products on their skin. You should never put things that have parabens in the product on your skin. If something has fragrance in it, you should not put that in your skin, and you should not breathe that in your lungs.
Yeah.
Like, just
by the way, when he says fragrance, that includes perfume, ladies. I stopped using perfume, I think 3 years ago. I used just essential oil perfume, if you want to say, and it's the most amazing scent ever. But yeah, there first dial in the basics, as you mentioned, but I think there's key things like that are kind of, we know so much about it now, like how to avoid the toxic products in your home, on your body, in your food. Like, we know so much more, so there's no excuse anymore. I think there's enough out there, especially even with the current election. I mean, that also has revealed a lot. So I would love to talk about external factors, because I know this is one of the things you talked about that I was like, wow, okay. I'm sure this disappoints a lot of people, but since I'm all into health, I know the importance of detox. One of the ways to detox is sweat, which is a sauna. Okay. So sauna, let's talk about it. I actually never used a sauna until last year because I was going through this whole detoxing, healing, health, and I'm really into biohacking. So I'm like, okay, I'll finally try the infrared sauna. And so I stopped it actually like 3 months ago because of another reason, but the problem with being or having implants and being in a sauna, what does that do? What do you recommend, and what do you not recommend?
Well, we had a client that most people will recognize, Lauren Bostic.
Yep.
She's a client of mine.
Mm.
And she was having extreme problems with using her barrel sauna, which got up to over 200 degrees Fahrenheit. She described it as she felt like she was just melting her implants. We used that expression on her podcast, and I got a lot of grief over that. So the proper way to think about it is the chemicals inside the shell of the device can be leached out into the tissues. And then you can see them in a toxicity test like we were discussing. So she had the worst tox test I'd ever seen on a human that I've taken care of, with heavy metals coming out. And then we did our explant and repeated our tox test, and all those were gone, meaning they weren't in there anymore. And so she didn't do some rigorous type of detox with us. In fact, she went to Lake Como for the summer in Italy and hung out. So it wasn't some other system she used. We did her explant. Everything went extremely well with that. And then when we had the opportunity to repeat the test, we repeated the test. So when people want to sound off and or troll me for, discussing that, the discussion revolves around the extreme temperature that she was using. And then it's like, well, you can't melt an implant, Dr. Whitfield. And I'm like, yes, I get it. But the actual process that's going on is leaching chemicals or components of the shell into her system or any patient's system. Now, when it comes to infrared sauna, the max temp is, 170 on a lot of those Fahrenheit. Yeah. But then the depth of penetration is supposed to be deeper, and that's supposed to be the whole thing, right? So you can bet your ass nobody has the answer to this question, and I probably have more of them than most people. Mm-hmm. So I just, if you don't feel well after a sauna session, don't do it again. I mean, don't be an idiot.
Right.
That's a good soundbite. Don't be stupid. Just, hey, if you don't feel good afterwards, don't do it.
Right.
I can't guide you because, I'm not taking care of every single person who walks the globe who has a flippin' sauna. But just in general, if you don't, feel good afterwards, everybody should look up what a Herxenheimer effect is. So that means if you're detoxifying something, which is what Lauren was doing, her body was trying to detoxify what was going on. And she was dumping so much into her system at one time, she didn't feel well afterwards. Mm. So that's a Herxenheimer reaction. So that is really, we don't want people experiencing that because that's not good either.
So would you say that relatively people with implants should avoid a hot sauna, infrared or not? Because I know the temperature, there is that temperature difference, but you did talk about it, how infrared penetrates deeper.
Yeah, I mean, the guidance is if it makes you feel bad, just don't do it.
Okay, clear.
Yeah, I mean, I can't sit there and, I don't have everybody's test. And once they've heard me, they kind of on their own, to their own, they just discontinue. So I have people come see me and they're like, oh, once you said that, I just stopped. And, so then I don't even have more information, regarding their specific situations because many people come to me after hearing that and they've just stopped.
Gotcha. Okay. I know a lot of people, they say it has a 10-year shelf life of the implant. Do you need to explant regardless after that 10-year mark? What's your
So all of that really boils down to a discussion around when devices rupture. So after the 8 to 10 year mark, the rupture rate increases 0.5% per year. So it's not that anybody needs to be, exchanged at that point. The discussion is revolving around increasing rates of rupture over time. And then everybody should undergo, their own surveillance. There's options with high definition ultrasound, which doesn't increase, obviously, radiation. There's something called QT imaging, which Dr. Jen Simmons has promoted. It uses no radiation. It's not painful. That's a great tool. There's MRI, obviously, which has no radiation. So there's lots of ways to look at this that don't require a mammogram. Thermography is not an adequate way to image a breast implant. So, that's not a diagnostic tool that I would recommend using to show whether or not there's a problem with an implant.
Okay, great. Okay, going into Explant a little bit, because I want to obviously wrap this with a bow. Explanting, if somebody is considering explanting because they're noticing they either don't want them anymore, or they're like, I feel intuitively this is what's causing my problems. What are the things they should ask for from a doctor if they're not able to go to you, which is, you're the expert in it? They're trying to find an explant doctor. What are the things they should ask, and what should they avoid?
Well, I think basically in our paper, we showed that there's a 29% incidence of bacterial contamination. So then it becomes the discussion of, are you going to take the capsular material out? How are you going to take it out? And so suffice to say, if the person you go see, if it's not me, the question is, can you take the capsular material out? If that conversation is one which is met with, hey, I don't think I can do this, it's dangerous, it's not safe, then that's not the correct person to take care of you. So, I did a host of, cancer operations, and when I transitioned to mostly, explants and now completely doing explant surgery, it wasn't really a difficult, transition, for me, because I'd done a lot of complex surgery, previously. It wasn't a big deal. And so just like doing fat transfers, which we've offered for augmentation of breast and buttocks for a number of years, like, you either have experience doing those things or you don't. So I was a reconstructive surgeon who did tissue reconstructions. I dealt with implant-based problems. I did fat transfers, but I did them for years into, almost 20 years of my career. And now my career is almost 30 years old. So it's not something that was new or novel to me. So when you ask me, does a fat transfer work? Well, yeah, of course it works. Does doing a capsulectomy increase the risk to the patient? Well, every time you do a breast implant surgery or explant surgery for cancer or cosmetics, there's those associated risks. Is it increasing the risk? Well, no. I mean, that's just something that's part of doing, those types of procedures. And I always tell people the same thing. Like, if you go in there and you're asking a surgeon to do something, and that is met with what you perceive as they're not comfortable with doing that, then you can't make them comfortable. Like, you should never try to make a surgeon comfortable with doing something.
Right.
It's a yes or no. That's it. That's, you don't take a Volkswagen to a Ferrari mechanic.
Right. Have you ever heard of this? I'm just I'm curious to ask this, because I have a friend of mine that she got an explant, and she's from an international country, had it done by the best doctor in that international country, and he kept the biofilm in it, and he tied it into a knot to keep the volume. Have you ever heard of that?
You cut out. Say it again.
Oh, sorry. He left in the scar tissue and tied it into a knot to keep the volume of the breast. Have you ever heard of that?
So the keeping a scar capsule to not disrupt, the breast, in this situation, given what we know about bacterial contamination and biofilm, doesn't serve the patient. So if the patient's symptomatic and the question has to be resolved with the capsular material, currently there's not a way to know that, preoperatively. So, in our instance, we know that this certain number, in our study it's 29, in other studies it's almost 50%. That's a big range. So if the patient, which, I have patients come to me who have had implants taken out where the scar capsule was left, then they come to me to take the scar capsule out because they're still having problems. That's now putting someone through two different operations that could have been solved at one time.
Absolutely.
And that doesn't make, sense in in this situation. One, you can do the operation safely at one time. Patients who have very small amounts of breast tissue would be better served to later have a fat transfer. So we offer that. We try to do ones that make sense for the patients at the time, so a simultaneous fat transfer. But those are, case by case, working them up and making sure that we have a better understanding of their, situation at that time. We just want to make it I try to optimize things as much as I can for patients, knowing that there'll be some patients are always going to do better than others, and other patients we better serve to wait to do fat transfers. So, yeah, it's not the easiest thing in the world to sort out all the time.
Yeah, absolutely. And what if somebody's in the midst of doing IVF and they are, timing matters and they're trying to conceive, but yet they have these implants. Maybe they're not having symptoms yet. Can they wait to do it after breastfeeding? Or what would you recommend if somebody's in kind of that, they're in the process of trying to conceive? And
I've had people who've failed IVF and then explanted, cycled, and had a child. And then I've had people failing multiple times and then have an explant and then go on to have success. I've had people come pre-IVF to get explants. It just depends. I don't want to, counsel one way or the other. I would say if you're trying to put yourself in the best possible position, then you got to figure out ways to decrease inflammation in your system, because that's always going to be more of a challenge to get and conceive pregnancy.
Okay, great to know. Okay, how does somebody prepare for an explant? Because I believe you have to put certain things in place to actually prepare your body for it. Like, is there a protocol you put them through to prepare for it?
Yeah, so our methods have been published. It's in my book, Sharp. And to engage with me specifically, you have to run our specific processes and programs and do our testing and supplementation, because the thing that keeps changing all the time is obviously the patients. We have the program in place now, and we've opened it up globally so patients can access both the readings and supplements and our detox programs without having to have surgery here now. So we feel like that's the best situation for patients, because you want to help lower your inflammation, and we can give you proven ways to do that clinically. So that's how we expect and want everybody to proceed now.
Okay. And then the Sharp method, I know you mentioned if somebody doesn't go to you, they have access to the Sharp method.
Yeah, you can go to our website, drrobertwhitfield.com, and you can access the way to interact with my team and get set up for that. So if you're unable to come to Austin, or if you're having surgery in another area, or if you just want to try to lower your inflammation now, that's the best way.
Great. And is there a certain timeline of healing afterwards, besides the normal surgery healing, of course, but like the protocol, if somebody is having all these symptoms, is there a typical timeline that they start to feel better?
I've had patients run it, and we just look at things on 3-month windows. So for the first year after surgery, we're working with patients exclusively on that time frame, but then people extend beyond that because they need more help in their journey.
Gotcha. Okay. And if somebody is considering implants still today, because we know that I'm curious the percentage of people that are getting implants compared to before, knowing what we know now. And then also, if somebody's still thinking about getting implants, what do they need? Like, what would you say to them?
So I think when you're going through the process of determining, whether it's for cancer or cosmetics, what are the long-term ramifications, you need to understand that this is an evolving issue. There are certain amounts of problems with breast implant associated cancers. Those have to be explained, and those are part of the informed decision process. Biofilm is part of the informed decision process, understanding that implants of any variety can get infected is just part of the informed decision process. Still the most common form of breast reconstruction in the United States is still going to be with an implant because of the size of the country and the access to that. That's going to be always the form that's most dominant. And then for cosmetics, about 2.2 million implants are placed annually worldwide. and that number is going up, not down.
So fascinating. I would totally think it's going the other way because now boobs aren't as in as they were before. Butts are in, boobs are not as much, but that's so fascinating that it's still like, even with everything that's out there today, people are considering it.
Well, that's statistics are only as good as the input of the data. So you don't know, from a specific, number, whether it's, how many are placed versus I'm telling you how many, we're seeing as explant. We don't know those numbers. I can give you, if you just say 2.2 million annually get implants, and we'll just say it takes about 10 years to develop the problem, and about, a third of the people will have biofilm, then you're looking at, on the low end, 6.6 million people have an issue. And then on a high end, 30, 40, 50 million.
Wow. Oh my goodness. Okay, so I mentioned that I wanted to bring this back up and we could kind of wrap with this. Mental health, I think, is a big component of this because I know a lot of people, it's a self-image thing, right? That's a lot of the reason why women get implants. So what is your thoughts, or what can you say to people's mental health to be prepared for such a thing? Because it is a big deal to, what will I look like after getting this explant? Of course, health is a priority, but I'm worried how this will affect me mentally.
Well, I feel it is a big image issue, and it's something that people should explore before they ever consider having surgery. So getting therapy, whether it's EMDR or another type of therapy, to, really establish what it is that this is going to do in their situation. Because I'm not a mental health professional. My team is not composed of mental health professionals, but we get a lot of negative energy, based on this after. And we do our best really to support patients, but I don't have, the background it would take to really help people with, grief resolution or therapy for body image issues. And we understand it's a big change, but it's best to really, you want to work on those things personally. Like there's nothing holding someone back from learning more about what is causing, their own, issues, other than them not taking those steps to learn.
Right. Yeah. So much goodness in this interview, but I know there are so much more. That's why you have a podcast about this whole topic, and that's why you've done plethora of interviews. So I really encourage people to learn more. Of course, look up Dr. Rob Whitfield's podcast. It's called what was it called again?
Breast Explant Surgery and Recovery.
Okay, so that's your podcast. It will be in the show notes. And of course, where can people best find out more about you?
Yeah, we set up everything through the website, drrobertwhitfield.com. You can go there. They'll have links to the pod, the book, the blog, appearances I've made on shows. And we have a lot of really great interviews with patients. So I encourage everybody just to explore those. And that's the best way to, easily learn.
Thank you so much. This has been a wealth of information. So thank you again for making your time. And thank you for the work you're doing today. And of course, hopefully eventually I'll see you in person to go down my journey. Cause I know it's ahead of me, and, we're possibly doing IVF and all these things. So I have things to think about. So some of them were personal questions I asked, but I know I'm not alone in this. So thank you again for everything. Appreciate you.
Thanks for having me on.
You're welcome.